So today we're going to be looking at another skin condition known as psoriasis. So psoriasis is a bit different from scabies because psoriasis is not caused by mites or all those other things. It's actually a chronic autoimmune skin disorder that causes rapid buildup of skin cells, leading to thickened, scaly patches on the skin. So these patches, they are often red, they are itchy, they are dry, and they may crack or even bleed. And unlike scabies, psoriasis is not contagious, meaning you cannot catch it from somebody else. So psoriasis often goes through cycles like flares followed by periods of remission. So sometimes a person can have like the heightened stage of the infection, and then sometimes there can be periods where the infection does not come with any symptoms. So this psoriasis, it can affect people of all ages, but it is most commonly seen in young adults and middle-aged individuals. So when it comes to the skin consists of three main layers, like we discussed in the last video. The epidermis, the outer layer, where for scabies, that is where the tiny mites, they particularly attack. Then so we have the epidermis, we have the dermis. So the epidermis is the outer layer, the dermis is the middle layer, containing blood vessels, nerves, glands. Then the subcutaneous tissue too is the third layer, and is the innermost layer of the skin, where there's fat and connective tissues. So in normal skin, it takes about 28 days for new skin cells to form and reach the surface where they are shed. Then in a case when a patient has psoriasis, the immune system mistakenly attacks healthy skin cells, causing faster cell turnover within 3 to 7 days instead of 28 days. So basically, the person sheds the skin faster than they are supposed to. So the skin cells, they pile up on the surface, forming thick, silvery white scales and inflammatory plaques. So looking at the pathophysiology of this condition, psoriasis is primarily driven by immune system dysfunction. So T cells, which are a type of white blood cells, they become overactive and they release inflammatory substances, including proteins like tumor necrosis factor and interleukins, which stimulates rapid skin cell production and inflammation. So this eventually leads to excessive proliferation of keratinocytes. Keratinocytes are skin cells, and it also leads to accumulation of dead skin cells and also inflammatory responses in the skin, and sometimes inflammatory responses in other places like the joints. So what exactly causes psoriasis and what are the risk factors? So the exact cause of psoriasis is unknown, but it is believed to involve a combination of genetic, immune, and environmental factors. So the triggers include, for example, stress, infections like strep throats, skin injury like scratches, sunburns, cold weather, certain medications like beta blockers. Those are the metoprolol, bisoprolol. So certain medications like beta blockers, anti-malarials, and lithium. Then also alcohol and smoking can also be a trigger. So there's also a strong genetic component that about 1 in 3 people with psoriasis have in their family history. So that too should be noted. So for types of psoriasis, because we have different types, so there's plaque psoriasis, which is the most common type, where there are red patches with silvery white scales on the skin. Then we have guttate psoriasis, In guttat psoriasis, we see small drop-like spots, often after a throat infection. Then we also have inverse psoriasis. And inverse psoriasis, we see smooth red patches in skin folds. So, for example, we see these patches like under the breast or in the groin. The fourth type is pustular psoriasis. In pustular psoriasis, we can see white pus-filled blisters with red skin underneath. Then the final type is known as erythrodermic psoriasis, which is the most severe type, and it comes with widespread redness and shedding of the skin, and it can actually be life-threatening. So those are the 5 types: plaque psoriasis, guttat psoriasis, inverse psoriasis, pustular psoriasis, and erythrodermic psoriasis. So for the signs and symptoms, the symptoms that patients with psoriasis have is number 1, presence of raised red patches on the skin, usually covered with silvery white scales. Then there's also itching, burning, soreness, dry, cracked skin that may bleed. Then there's also thickened or pitted nails, and in some people they can also experience joint pain and stiffness, and this is known as psoriatic arthritis. So the common areas that that is affected by this psoriasis, we have the elbows, the knees, the scalp, the lower back, and in inverse psoriasis, it particularly affects folds like the armpits, under the breast, and the groin. So for the diagnosis of psoriasis is mainly clinical, based on the appearance and distribution of the skin lesions, and in uncertain cases a skin biopsy can be done to rule out like other conditions that it might look like. And nail changes and some joint symptoms may indicate that the person has psoriatic arthritis. So for other conditions that could mimic this psoriasis, like psoriasis symptoms, so eczema, like atopic dermatitis, which is more common in children and is often more itchy than psoriasis. Then fungal infections like tinea infections, but tinea infections are usually limited to one area of the body. And then there's also a condition known as lichen planus, which comes with flat purple-like lesions, and also cutaneous lupus, which comes with a scaly rash, but is typically comes in areas that are exposed to the sun, like areas of the body that are exposed to the sun, like the face and all those things. So for treatment of psoriasis, psoriasis treatment depends on the severity, the location, and the patient's preference. So for mild or moderate cases, we could give topical treatments like corticosteroids to reduce the inflammation, and we could also give vitamin D analogs like calcipotriol, which slow skin cell growth. And then we can give coal tar. Coal tar acts as like an anti-inflammatory, it has anti-inflammatory action, and it slows the skin turnover. Then we can also give salicylic acid, which helps to remove scales from the skin, and moisturizers too. They reduce the dryness, the cracking. They are just generally good for this kind of conditions. Then we can also try phototherapy, like ultraviolet B light therapy, which also helps to slow the skin cell turnover, and is usually given in hospitals or special kind of clinics. Then some systemic treatments that we could give, and these systemic treatments are given in severe psoriasis or moderate to severe psoriasis. And the kind of treatment we give is For example, we give methotrexate, which helps to slow the immune response and the cell growth. Then we also give architretin. So this is a kind of vitamin A derivative that is also given for severe psoriasis. Then cyclosporin, which helps to suppress the immune system, and some biologic therapies which target specific immune pathways, like for example the tumor necrosis factor blockers or the interleukin blockers. So usually systemic therapies, like the drugs that we give for systemic treatments, they require monitoring of side effects, especially like liver, kidney and blood count. So when we are giving these drugs, we have to be specific, we have to be careful to check all these parameters. And when it comes to the management of this psoriasis condition, it's good to identify and avoid the triggers. If it's stress, if it's smoking, if it's certain infections, just try to avoid these triggers and try to use emollients regularly to keep the skin hydrated. And sunlight can help, but it's like moderate sunlight in moderation, not too much. And it's good to adhere to treatment and understand that the management for this psoriasis can be long term. So also this psoriasis can actually have some psychological impacts on many patients, because it can make them to struggle with self-esteem and they can have anxiety. So it's good to address these psychological effects that this psoriasis can give to the patient, because this is the person's skin. Like these are like parts of the body that is exposed. So the psychological impact of this psoriasis, it also has to be addressed. So in summary, psoriasis is a chronic autoimmune condition that speeds up skin cell production, leading to thick red scaly patches. It is not contagious but can significantly affect a person's quality of life, and diagnosis is clinical and treatment ranges from topical creams to systemic immune modulating drugs, and management includes avoiding triggers, treating flares and supporting the patient psychologically. So it's good that the patients are counseled on the medications they are taking, and they are taught to how to identify their triggers, and also told about the importance of treatment adherence. So that is basically the summary of this skin condition known as psoriasis. Thank you for watching. See you in the next video. Bye.